Good afternoon, ladies and gentlemen. And today I'm going to show you three different kinds of indications. First of all, teeth trough orbital frame. And actually, we have four classifications of teeth trough. Here beside me, we have a lady. She has both hollowness and puffiness. And I am working with amalian smooth line, and it's a monophasic product. It's produced in Germany by Skin and Vision Technology. And I hope we can later now today show you some before and after pictures. We had some problem with the computer, but anyway, I would like to have the camera quite close now to the patient, please. Could you zoom in? A little bit more, please. Okay, so if we look at her, she is actually a patient for a blepharoplastic, of course. But I find out the last 7 years that I can help people both with puffiness and with hollowness. So if you look up, can you see the correcting need, both lateral and medial? Can you see that? Yeah. So what I'm doing, I'm using the soft fill cannula, 25 gauge. I never ever had injected the teeth trough orbital area with a sharp needle, and I am using a linear technique. And to correct the puffiness, I am injecting with a linear technique just below the rim of the puffiness. As you know, this area is very sensitive. It's a high-risk area, and I believe with the cannula we have less problems. So it's a monophasic cross-linked filler with dry particles. Pardon? So what I'm doing now, I'm going in with the cannula. I go supraorbital, and I tell the patients to look up. And with the cannula 25 gauge, you can see where I have the tip. I am injecting first one line, injecting very slowly, so I have totally control what I'm doing. In this case, we need maybe 0.7 milliliter per side. And now I'm doing the second line. It's just under the first line. And I believe that the teeth trough, it's always a two-step treatment. So very slowly injection. And as you can see, the patient she's really relaxed, no pain at all. After that, I am massaging the product upwards like this. You can ask me questions during I injecting, because it's not a problem for me.
Okay, how much did you inject?
Yeah, just a second, I have to control here. It's 0.2, and I believe less is more. I believe that it's better to take the patients back after 2 weeks' time and add more. So you can look up again, and I can see we need a little bit more of product. So I go in again, and going deep on the periosteum, and injecting a little slight more, so 0.25. Okay, this was one of the injections point, and you can see now she looks much more filled up. Even if she has excess of skin, I can with this product plus the next time I see her, a little bit of volume in the zygomatic area. Look up, please. And I like to work with the soft fill cannula. It's very flexible, and it's really easy to inject with that one. The only bruising we can have is from the needle. And it's very important when we are entrance with a sharp needle that we are not going too deep, okay? So we see here, where is my hole? Can you give me the sharp needle, please? Okay, thank you. I go in again. Also, I would like to say to you, I've done a retrospective study of 150 patients. Now I'm just, sorry, darling. I'm just on the bone now. I'm sorry, darling. And I saw that the duration of this injection lasts more than 18, 20 months. And with the linear technique, we can really make it in a very natural correction.
Are you under the auricularis?
Yeah, just on the border, just on the rim of the muscle. Also, it's important to tell all the patients with this treatment that they have to moisturize the area morning and night, and when they take sun, they need to put the SPF 50. And after this injection, well, we can put it later. Okay, we do the other side. So the technique, if we're talking about hollowness, normally we are injecting in this area. Okay, but when we have puffiness, we need to cover in two points of injections. No questions?
Any questions from the audience?
So remember, this point is very important, that you are not going too deep. Okay, now I'm in. And I always tell the patients to look up so I can really see where I need to inject. Very good. So there is no risk to inject in the arteria angularis with this cannula. I started actually to inject with the 27 gauge, but I changed the routines. Now I feel more safe with the 27. So I injected totally on the other side, 0.5. Now I go laterally, and the patient is looking up, so I see exactly where I need to go. Stretching the skin a little bit. Very soft hands. So this is a very sensitive area, so we need to take it easy. And now I go down periosteo. There we are, supraorbital. And now I am injecting one line first, and to support the line, another one below. Voila. So totally 0.5, 0.4. And I'm molding it very nicely, very light hands. And you can look in the camera now. Do you see something down there? You see?
Yeah.
Okay. So after that, I am putting our cooling fluid that is antiseptic. It's cooling down the skin a little bit, and It's antibacterial, antiseptic, and take also away the redness. And it's very. What it? Yeah, we are finished now. So
Okay. Thank you.
Thank you so
Dr.
much.
Marie.
Thank-
Thank you very much.
So now I'm going to inject the neck. This is a patient for a neck. Can somebody help me to take the head? Can somebody help me here? Okay. I'm going to inject the neck with the cannula. The first product is SF16. It's a monophasic product that the particles are hydrated. And I will inject, if you see her neck, the lines of her neck. She has quite a nice neck. And if they have visible platysma bands, I am using, first of all, I do the Botox, the Vistabel, on the platysma band. And then after 2 weeks' time, I take her back for the correction of the vertical lines. Can some gauze, please? Compress. So if you see here, she's quite good actually, but she has some small little fine lines. And what I'm doing, I'm using the 22 gauge cannula. And I have one incision here, one here, and one on the other side. I'm going into the hypodermis. Very nice. Can you take the pillow away, please? Raise up. Okay. And with this cannula, the size of the cannula, there is no risk at all to go in intravascular. Can I have? Yeah. Okay. Now I'm just in the hypodermis. And I'm following.
Yes. What size cannula are you using? Sorry,
I'm using the soft fill cannula, 22 gauge, 50 millimeter long, because it's quite difficult to entrance with a 70 millimeter long cannula. I find it out. I have to do more incisions point, but I find it much easier. And I just following the lines. As you see, there is no bruising. And to work with the cannula, you need to understand that the preparation of the hole, like now, you see what I'm doing? I'm going back again and make it. I work a little bit like this, stretching out the skin. Mm-hmm. Wonderful. Is it okay, darling? So sometimes it's a little bit more difficult to come in, but I never give up. So now I am just now I'm in the hypodermis. I'm going just around this point. So I meet up here. And also I combine this always with mesotherapy. We have a product I call Balance, the linear hyaluronic acid, to really hydrate, especially the center part of the skin, of the neck, sorry. And I have seen also the duration of this treatment is quite long time. So if they have 2 or 3 or 4 lines, I go for the lines. But this lady, she was fine with this one. And this also stretching up the skin, so it will be more stretch if I put a little bit more. Okay? And then, of course, molding and make the massage. So if you understand, first is 3 steps treatment. If the platysma band is visible, I put the Botox first, then I go with the cross-linked filler, and then the meso.
How much volume have you used so much?
I can say that one vertical line is about 0.8. You need quite a lot of products, actually. So now the cooling fluid. Then I will do a lip also, and I put some local.
You are in front of the camera. If you could.
Oh, I'm sorry.
Yeah.
I put some local anesthesia. I'm not doing an infraorbital. I'm doing a mucosa infiltration. So, because I prefer to have a painless patient, and even if we have lidocaine inside, it's the 1, 2, 3 teeth and just in the sulcus. Even if we have lidocaine inside the product, my experience is that it's quite painful with the lips. Yeah. Can I have this one, please? And I prefer to work with also the cannula. And if you have quite an old lip that is turning inwards, I do a linear technique, but I also do the column. So I will show the both of them. Can you hold this, please? And here I'm using we have 2 products for lip augmentation, is the SF20 monophasic, and it's for more delicate injections. We have the natural lip that is 14 milligram per milliliter. Hold this, please. Stand here. And I prefer to, to inject. I don't want to overcorrected lips. I want to have natural lips. I mean, to keep the shape of the lip. And now I'm hold the lip, and I'm in the middle of the red lip. You see that? And
Yeah.
I hold it like this because it's much easier. Because if I am injecting too low in the red lip, I will have a dropping lip. And now I'm injecting just 0.5. No, 0.15. Okay? Then I need to take her head down. Can somebody help me with that, please? Like a bit like that. And then I am taking, I can do the other side first. Okay, we go the other side. So the cannula is really nice, and also it's less painful. And you see, just this little hole in the middle of, what I mean with the dropping lip, what I mean with that, if you are injecting too low in the red lip, you will have the mucosa full of the product. So you have to be keen on that you are injecting in the middle of the red lip. This is what I'm doing. Oh, it's so small. Okay, I'm holding my lip now.
Dr. Ingman, you have 2 minutes.
2 minutes left.
Mm-hmm.
Oh, I'm sorry. The time passed very fast.
Yeah.
Okay, now I take the sharp needle. It's in the package. And I'm working. I will finish here. Normally the depression is like in lateral part. So I never ever work too much in the central part because I want to keep the shape of her lip. And I going down with the needle, not too deep, because then I'm in the mucosa, and I am taking a little drop on the vermilion border to sharpen it up a little bit. And this treatment makes the lip fuller, but also turning the lip outwards. Okay, so very small amount. Okay, thank you. And then I'm molding it, and we put some cooling fluid on. And of course, you can also make the lower lip with a cannula. You can make the little bit of contour in the center. So,
Before you cover it, can we just see her sitting up to see the lip?
yeah, of course. Oh, no, she's a little bit. I keep the shape of the lip, and that's what I like. And I like just to make the lip a little bit more out and round up.
Thank you very much.
Thank you so much.
Thank
It's
you.
a pleasure. Thank you.
Ladies and gentlemen.